your county government show. I'm Deb Gruber, your host, and today I'm joined by Amanda Rorick.
Yes,
welcome.
Thank you.
Mandy is a public health nurse with Public Health. Specifically, you work with kids in a couple of different programs, correct?
Yeah, I work in a few different areas. I work in the WIC clinic, I do family home visiting, and then I also work as the disease prevention and control.
Great, and that's what we're going to talk about today.
Yeah.
All right, well, first, tell us a little bit about yourself and what brought you to Morrison County.
Sure. I have been a lifelong resident. I just moved out for a couple of years when I first got married, but we're back. So we currently dairy farm outside of Uppsala. I have 2 kids. And then I have been a nurse, an RN for 8 years, and then just recently with the county for about 8 months.
Well, great. Welcome. It's good to have you.
Thank you.
Let's talk about disease prevention. Let's talk about some of those duties, in particular the flu season is upon us.
It's definitely a big one, something that everybody knows about and everybody's concerned about every year. And so we're just here to, fun facts, everybody knows what the flu is, but we just want to really put out there what we can do to help keep ourselves healthier this season.
It's a good reminder. It's one of those things that every year we need to remember again what we need to do to stay healthy so we can stay on track.
Sure.
So what are some of those things? What do we need to pay attention to?
So really we need to specify what the flu is. And flu is different from what most people call like the stomach flu or the stomach bug that can cause an upset belly. Influenza is what we call flu season, and that is a contagious virus that usually affects our lungs, our throat, and our nose.
Okay.
So it's quite different from the stomach flu.
The stomach flu with the icky...
upset belly and stuff.
Sure.
Yeah.
Okay. Symptoms, signs of that then is more respiratory?
Yes, more respiratory. So again, it affects more of our throat, our lungs, and our nose. So influenza is caused by a droplet, and so being in close contact with somebody who's sneezing, has a runny nose, we can get that. So really our telltale signs of influenza could be some body aches, fever, chills, cough, some congestion, and then of course the sore throat. And it usually comes on very suddenly. It just doesn't develop over time where you have a cold for a couple days. Usually it hits you and you just feel pretty crummy.
Oh, is it impact or does it affect people differently?
Yeah, it definitely does. Depending on your age, your health status, it can affect how the bug affects you and how long you have it and how severe your symptoms may be.
Okay, so it could look different between like me or my husband or my kids or even that.
And being in a contagious period, sometimes some people won't show symptoms for a couple days before they have it. So they could be spreading the influenza virus and not know that they have it until, boom, you got all of the symptoms and you're feeling pretty crappy.
Ooh, which makes it hard to prevent it, but are there techniques? Are there some things we can do to help prevent it?
Yeah, there are lots of things. First of all, are getting our flu vaccine. The CDC, our healthcare providers, we always recommend getting your flu vaccine every year. And then other ways would be good hand washing, of course, staying away from people who are ill, that who are ill. Eating a healthy diet that's balanced, fruits, vegetables, drinking plenty of water. And of course, really good hand washing.
Which we're going to talk a little bit more about
later.
later.
That later.
All
yes.
right. You mentioned the flu vaccine.
Yes.
Is now a good time? When are the prime times to get that?
We always recommend getting the flu vaccine as soon as it's available. And so that's usually late summer, like in September. But prime flu season is from October all the way through May. Typically, we kind of associate flu with our colder season months. But we recommend getting it as soon as possible and getting yourself covered because it takes about 2 weeks for the antibodies to build up and for the vaccine to be effective.
Okay. Who should get this vaccine? Everyone, or are there people who shouldn't?
Yeah, we definitely recommend that everybody who can get the flu vaccine. And so that's really talking to your provider and getting in there, inquiring questions about which vaccine you can do because there are a couple different vaccines. But anybody who's over the age of 6 months and up should get the vaccine, especially people who might be already at a compromised health state.
Okay. So it is important for people who already have other issues.
Yep.
Even more important, it sounds
and more important, or even for us to protect ourselves from them. If somebody is really immunocompromised where the vaccine would not be effective for them and could make them potentially more ill, that's why it's important for you and I who are healthy to get the vaccine so that we don't increase their chances of becoming even more ill.
Makes sense.
Yeah.
Makes sense. we talked about anywhere from September on to get the flu vaccine. Now there's shots and there's a mist. Does that still exist? Or
Yes.
what is there?
The nasal mist still exists. It's still useful. It is a live vaccine. It's weakened, so it still doesn't cause the flu like most people kind of associate it with.
Sure.
But people who, that one kind of pertains to a certain people who are more healthy. Kids who are over the age of 2 would also be, and it's like I said, it's a live vaccine, so it's weakened, and we don't want people who already have a respiratory problem or already have a weakened immune system to receive the flu mist. They would be more qualified for one of the shot forms.
One of the shots.
Yeah.
Interesting. How does it mean I'm absolutely not going to get the flu because I had my flu shot?
No, it's not 100%
Okay.
preventable. It is your best chance of preventing the flu, of course, but the vaccine can vary from time to time. It is considered yearly. On average, it's about 60% effective. Of course, some years it's more than that, and as we all know, last year it was less than that.
Yeah.
And that's because the vaccine it's a type of match against a influenza virus. And of course, every year the influenza virus is different. So how effective the vaccine can be is what its match is to the virus that is currently going around. Yeah.
Interesting. There's a lot of scientific
There's
thought
tons
put
of
into that
research
stuff.
and tons of ways that they make the vaccine every year, and they consider all of those. And of course, last year being not so effective, there was tons of research studies on how to get ourselves ready for the flu this year.
But the experts say that it's still much better to
Yes.
get it than to not get it.
Right, and the reason being is that the flu vaccine can still give you the chance of making your severity of symptoms and your duration of having the flu less. So how ill you become, the flu vaccine can actually make that go a little bit quicker, to make your symptoms a little less severe and get you back to feeling healthy sooner.
And anybody who's had that, I know we had it once when my 2 children were quite small, and my husband and I and our kids had it, and it was a
Yes.
miserable experience.
It's
So
not
if you've
fun.
ever gone through actually influenza,
Yes.
it's not something you want to repeat if you don't have to. that's
You
for
don't
sure.
definitely don't want to feel that way again.
No, not at all. How do people learn more about this, Mandy?
Yeah, there's tons of websites out there, but anything on the internet is, resourceful or not resourceful. So the CDC's website, the Center of Disease, is a really good website. Talking to your physician,
Sure.
they have tons of great information. And of course, here the Minnesota Department of Health is also a good one.
Right, and locally there are a number of places that administer the vaccine, correct?
Yeah, our pharmacists are allowed to do that. So you'll see signs up at Walgreens and Walmart and even Colburn's going to your local clinic, whether it be Family Medical or up at Lakewood in Motley and in Morrison County is also, they are great sources of getting your vaccine.
Great, lots of options, lots of choices.
Yeah.
Thinking through getting that before the flu season's over is important.
Definitely. We want to get it now so we can prevent it. But at any time during the flu season, we recommend getting your flu vaccine. So if you didn't get it now and you want to wait, I probably wouldn't recommend that. But if it comes December and you're like, is it too late to get it? No, please get your vaccine.
Okay. Now, most insurances cover that. Are you familiar with that at all?
I'm not really familiar on the whole billing part. Most insurances cover that, but how much they cover it or not, I'm not entirely sure.
Okay, but I think it's certainly worth an ask and make sure you
Definitely.
inquire
Yep.
into that to see
Yep,
what
and
it
talk
is.
about billing or even ask your physician's office.
Okay.
They should be able to help you out with that.
And with pharmacies offering opportunities, it really is much easier than I think it used to be.
It's a lot more accessible, and we're making it easier to get out there and spread the word that our vaccines are important and that we need to get those so you feel healthier.
Well, great. And healthy kids in school is important. Healthy employees at work are important, and healthy, elderly that are at risk for more.
We want to keep the most important is our family and loved ones.
Yes,
and
exactly.
So we keep ourselves healthy, we can keep them healthy.
Perfect. Well, great. I believe we have more to come on washing our hands and doing all of that. So we will join you back at the government center to do a little bit of an experiment on making sure we stay clean and germ-free as possible so we're not spreading things. So we're going to do that. But just as a reminder too, before we do that, the York County Government Show is aired at Fridays at 2 p.m. and Saturdays at 7 p.m. at Charter Channel 180.
So we are going to do a good hand washing demo. And what most people don't know is that you could just wash your hands, you can still leave lots of germs on there. And the best way of preventing the spread of infection is good hand washing.
All right.
So what we're going to do is just put this on, and I want you just to kind of rub it all over because this will be the dirt.
Okay, this is my dirt. I have dirty
this
hands.
is your dirt.
Okay.
And so you come in like you've sneezed. Oh, now I got dirty hands. I need to wash my hands. So
Okay.
wash your hands like you normally would.
Okay.
And the soap is up there.
Oh, and use soap.
Yeah,
What
use
else?
soap.
All right.
All right.
Dry
and
them
you can
off?
dry them off.
All right.
And so we're going to show to see if you have any dirt left behind.
Okay. I need to turn the light off.
Yep. Let that boot up.
Oh my goodness.
And if you see that the germs are still sticking around our thumbs and in between our fingers and on our fingernails. And that's where most germs like to linger out. Up on the wrists. And
Oh, wow.
so what we're going to do now is some tips on how to do really good hand washing. Some tips and tricks on how to get really good hand washing. And so we're going to get the soap. And so good hand washing includes rubbing our hands together, not vigorously where so much where we would cause pain or our skin to come off, but we do want it to be effective. And getting in between our fingers, around our fingernails, so you can go like this if you want. Our thumbs, we want to get up there in our wrists. And we want to do this for about 20 seconds. So a way to remember that is, you might want to lather.
Yeah.
A way to remember that is we can sing happy birthday to ourselves twice in our head or sing the ABCs.
All right. Well, I will sing in my head because we do want our audience not to hurt their ears. So.
And then a good way to rinse off is one at a time.
Oh, okay.
Yeah. And we got up there, and then dry your hands before we shut the faucet off because, of course, the faucet has germs on it.
Oh, sure.
Yep.
No, I'm not quite dry yet. All right. And shut the water off.
Yeah, and now, and then toss.
Toss. Okay.
And now we're gonna see how much
little
better. And
oh wow.
not as bad. See around our fingernails, we're still really good. Where before they were kind of caked on.
Yes.
Yeah, and up by our wrist,
Much better.
much improved.
Wow.
So effective hand washing to prevent the spread of infection.
Good tip. Very good tip. Thank you.
Thank you.